And they're all funky. It's like funky, like.
Okay, ready your phones away. Just notebooks and pens. Ms. J said she's been reviewing patient safety, but I'm still going to do a review. It's all a review of patient safety after this computer apps. Okay. On your practical exam, of course, the ones who did it first try without error gets 100%. Okay. If you had like 1X, you get 97. You get 2 X's, you get 93. Okay. And then if you went for your second attempt, that's when you go 90. Okay, for your second attempt. A couple of things I noticed. Okay. Your prescription packet is not just for you to just like scribble on your answer key. Okay, on your blank sheets. There's a reason why we do this practice or work. The research process alone, looking it up on Medscape, on Macromedics, on drugs.com, rxlist.com, that's the biggest part of the learning process. Okay? That's the biggest part. You researching on the drug is the biggest part. And I noticed some of you, it's either you copied your answers from your classmates, okay, but it'll show on the practical exam. Okay, it'll show, okay, that you didn't do the work researching. Because I'll ask you, what's the generic? How come you don't know the generic? And these are drugs that we covered, remember? I didn't go get prescriptions from different systems. I stuck with EENT. I didn't even have cancer questions, right? I stuck with EENT, which is our topic, eyes, ears, nose, and throat. Oncology, which is cancer, and E includes eyes, okay? ENT. And antibiotics. Okay. So I expect, because I didn't use a different prescription, I expect you that you did your work. Okay. Because it will always show during participation on practical exam. So next time you get a prescription packet, make sure you're working on it. Make sure you're researching, putting in the effort to look for the brand, the generic, the class. Okay. And reading the SIG, doing the calculations as well. Okay. That's how you learn, and that's how you're not memorizing the drugs. That's how you know, like, okay, this is for this. And it's long term. It's not just for that moment, not just for that activity. Okay. You'll bring it with you till the PTCE. Okay. There was somebody who asked me, like, it's not PTCB or PTCE. Let me tell you. PTCB is the organization, Pharmacy Technician Certification Board, that administers the PTCE, Pharmacy Technician Certification Exam. Okay. But many people use just for clickbait the PTCB exam. Okay. But technically, it's called the Pharmacy Technician Certification Exam. Okay. And patient safety is a big part of the PTCE, not just of your final exam. I don't know what happened to my, yes. Just your final exam. Okay. So patient safety, when they redid the blueprint or the content of the PTCE, they included patient safety. That's why we added patient safety as a class and took out chemistry. But we incorporated the chemistry topics on pharmacology, which I've been discussing all the time, pharmacokinetics, pharmacodynamics, and all that basic stuff. Anyway, so patient safety helps minimize medication errors. Medication errors, what's the word? Medication errors are Preventable. Thank you. Preventable. Let's just take this out. Medication errors are preventable. Okay. We can't fully prevent them. Okay, so let's try to help minimize that. Let's start. We've been talking about patients' rights, right? There were 5, now there are 7. Okay. And what are those 7? Right? Right patient, correct? Right drug, correct? Right strength, or right dosage, right time, right route or route, and what's the last 2 that were added? Documentation and education. Okay, this is a common question on the PTCE. It's an accept. What about the right price? No. That's the accept. Okay, doesn't only show up on your final, but it shows up on the PTCE. I've seen it. Like, which amongst this is not a 5, right? And it's the price that's in there. Doesn't matter what the price is. Okay. Next one. All adverse drug reactions should be reported to which regulatory body? MedWatch. And who runs MedWatch? It's under which organization? Good job. FDA. Yes, yes. So we have some law questions in here because it's part of patient safety and computer acts. Okay. Next one. The FDA, in addition to collecting data on drug reactions, also collect data for VAERS. Remember this? What does VAERS stand for? I heard it.
Vaccine error reporting program.
Vaccine, what's A?
Adverse.
Adverse, what's E?
Event.
Event, correct. And then reporting system. I got 2 points now, or 3. Vaccine. Adverse event reporting system. Remember, MedWatch is where you report adverse reactions, right? When it's specific to vaccine, it's this one. So what does this mean? Next one. Which type of error occurs when a technician is afraid to speak up and ask for assistance on a prescription element? Good job! Fear error. Very good. A medication error often results in this: an appreciably harmful or negative consequence of taking a particular drug. Side effect, adverse drug reaction, organizational failure, or root cause analysis. A medication error often results in this: an appreciably harmful or negative consequence of taking a particular drug. Yeah, I would not word it this way. And the PTCE will not word it this way. Okay? What is known? What is unknown? That's what you're going to see on the PTCE. Adverse drug reaction or adverse reaction. Okay?
Well, it results in adverse effect.
It's adverse drug reaction. Yes. Okay. But the PTCE uses the term known and unknown. So known is side effects. Unknown is adverse drug reaction, ADR. Okay? Or ADE, adverse drug event. Okay? Which of the following regulatory bodies issue the do not use list? I talked about this. Who issued the do not use list? What organization, before I give you option? Do not use list is issued by, it's in your PowerPoint too. Blanks do not use list. Oh, the trailing zero, the MG, the MCG. Which organization created that do not use list? I heard it. Yeah, so what is that? T JC. And TJC stands for the Joint Commission. Commission is double M, double S. Good job. It used to be called JCAHO, JCAHO. But now it's like too long, right? That's TJC. Okay. This type of error occurs when the proper medication education materials are not passed on to the patient. Documentation error, yes or no?
No.
Extra dose error, yes or no? Mislabeling error, yes or no? Medication education error. Because you didn't give the med guide, you didn't give the product insert, right? And give the education for that medication. Okay. This type of technology helps us select the correct medication, helps to make sure the correct patient in the hospital is administered the correct medication, and allows us to order inventory quickly and efficiently. I heard it! Barcoding system, yes. That's why those tags in the hospital, yeah, barcodes too, so that they can match that the drug that they're administering is to the right patient. Yeah, barcoding. When you're ordering, you barcode the bottle because you're out of it, right? So the barcoding system or the barcoding technology. Okay. Quinine and quinidine and quinidine. Quinidine and quinine sit very close together on the shelf because our shelves are arranged alphabetically by generic names, okay? A pharmacy technician must be careful to select the correct medication. This is an example of a
Top letter.
what?
Lassa.
LASA. LASA stands for look-alike, sound-alike drugs. And how do you prevent this? There you go. Okay. Why do most pharmacies not report the errors they make? About that before I give you options. Why do most pharmacists don't report the errors that they make? Fear of consequences. Correct. Their license might be taken away. There might be a lawsuit. They might be fired. So fear of consequences. Very good. This is a long final. Normal. 50 questions. I don't like this question because it's a statistics question. And it changes. That's why you usually won't see statistics question on PTCE. Okay. Annually, about how many people die in the United States from medication errors? There's a grammatical error here too. How many? Do you remember that slide? Death, how many? 7,000. There's actually 20,000 injuries every year. That was 2014 stats. I'm sure it's higher now. Okay. Around 7,000 people die in the United States annually because of medication errors. What is RCA? You remember what RCA is?
Root cause analysis.
Correct. And what is root cause analysis? Tell me if that's the definition or not. A type of organizational failure of a pharmacy to meet demand. A proactive approach that seeks to find problem before they occur. Is that a proactive or the problem occurred already? A systemic approach to identify the deep cause of something that has occurred. That is root cause analysis. Something already happened. So it's damage control. Okay. It's not a preventive measure. Okay. Next one. When a technician or pharmacist fails to gather all the information about medications, supplements, and allergies, what kind of error is taking place? Distraction error, yes or no? Fear error, yes or no? Selection error, yes or no? Incomplete information error.
Yes.
Okay. DAW stands for dispense as written, correct. This is a marketing strategy where a brand name product is brought to the market with different combinations of active ingredients. Remember my example was Sudafed and Tylenol for arthritis. They look the same, okay? So you really have to read the active ingredients and different indication, often leading to consumer confusion and error. What is this type of error? Mislabeling error, root cause analysis, product line spreading, or product line extension? Extension. They're extending the brand, remember, because the brand is too strong that they want to capitalize on the brand. Tylenol PM, Tylenol arthritis, Tylenol everything. Right? It confuses the patient because the brand became a household name. So they're extending the product line, capitalizing on the brand. Okay? It's a strategy. When counting which of the following drugs should we take the time to clean the tray off with alcohol? My answer is all. Okay? But if all is not in there, what's the most specific? Antibiotics. So if your option is sulfa drugs, penicillins, both A and B, vitamin C tablets.
Both and
Both. Because many people are allergic not only to sulfa, but also penicillin. Okay? But if penicillin is not there, only sulfa is there, sulfa is what you choose. Okay? Next one. NDC number. NDC stands for? National, not natural. Okay? National Drug Code. First 5 represents. Second 4 represents. Last 2 represents. First 5 is manufacturer code. Next 4 is product or drug code. Last 2 is package size. Always a question on the PTCE. Okay. What are auxiliary labels? Warnings. The stickers that you use so that you say warning. Okay. How many refills can a patient get on a 30-day supply of a C2 medication? 0. Good job. Okay. The ISMP, remember ISMP, what does it stand for? They always partner with this.
Institute for Safe Medication.
Very good. Okay. Institute for Safe Medication Practices. Practices, right? Okay. And FDA promote the use of this safety technique to help pharmacy staff choose the right medication bottle due to certain letters of the drug being bolded in an uppercase. Tall man lettering. Very good. When unable to make out an abbreviation on a prescription, what should the pharmacy technician do if you can't read the abbreviation or you don't know?
All the technicians should ask first.
Yes, always. Okay? Ask the pharmacist. That's always your answer. Or let me go get the pharmacist for you. Okay? If the pharmacist still couldn't read it or couldn't make it out, then the pharmacist will ask you to call the doctor's office. Okay? What internet-based program allows institutions and healthcare professionals around the globe, this is around the globe, this is in your slide, to anonymously document, analyze, and track adverse events? Oh, good job. MedMarks. MEDMARX. That's the worldwide one. MedWatch is FDA. You report it. Okay, to MedWatch. MedMarks for worldwide. Okay, if you want to track or document errors, this is worldwide. MedMarks. MedWatch is the program by the FDA to report adverse drug events. Okay, clear? What type of error occurs when an incorrect drug is substituted for the one prescribed? Is it a mislabeling error? Yes or no?
No.
Is it a medication education error? Is it a contaminated product error?
No.
Is it a wrong drug error? Yes. It's a wrong drug error. Or if there's selection error in there, selection error too. Okay? What is a sentinel event according to the Joint Commission? Sentinel event, a period of time without an error, a yearly event to report errors, an expected occurrence involving serious harm or death, or an unexpected outcome showing favorable results. Sentinel event. What is a sentinel event according to the TJC? Sentinel. What's a sentinel event? An unknown? What is that? An unexpected occurrence. Like an adverse reaction, a sentinel event. So do you consider an adverse drug reaction a sentinel event? Yes. Okay. Medication error is defined as, what should be the word you're looking for? Preventable event that may cause or lead to inappropriate medication use or patient harm. Okay, this one. The failure of a patient to take the medication exactly as prescribed is known as patient administration error. Is that a wrong administration? Omission error. You know what omission is? You omitted something, okay? The failure of patient to take the medication exactly as prescribed. Wrong time error. Medication non-adherence.
Wrong time, because you said she didn't take it exactly.
It didn't say time though. The failure of a patient to take the medication exactly as prescribed is known as medication non-adherence. Non-adherence, why? If it was, remember my example, the patient is given like 500 milligrams, but the patient knows that I don't have money for copay next month.
So they
Chops the tablet into half, right? That's non-adherence, right? Instead of 3 times a day based on the prescription, I'll just take it once a day because I want this to last longer. Non-adherence, right? Did not follow what's prescribed. Okay, medication non-adherence. Next one. A chronic disease with a compulsive and uncontrollable urge to use a drug substance when it is not medically necessary is known as addiction. Very good. Okay. Which of the following medications will require a med guide? Coumadin or warfarin, that's your A. ADHD medications, C, aspirin products, or D, both A and B? Both A and B. So your blood thinner, Coumadin and warfarin, as well as your ADHD medication. Okay. The following are ways that are helping promote safer narcotic fulfillment in pharmacy. E-scripts, using the PDMP, not checking DEA numbers or double counting C2s, both A and B. Both. Okay, remember now we send prescription. The doctors will send the prescription from his laptop, iPad, or software directly to the pharmacy. That's what you call e-scripts, e-prescriptions, okay? And what is PDMP? It shows up on the board exam. What does it stand for? PDMP.
Prescription drug monitor program.
Correct. Prescription Drug Monitoring Program. Every state has a PDMP. Okay. This is how we can help control or help with the drug abuse. Okay. Why? It tracks the prescriptions and especially the controlled substances. Say, for example, it's been filled in this pharmacy. The other pharmacy knows that. Okay. And sometimes state to state communicate. like Nevada communicates with a PDMP of California. Okay, so we know that it's been filled in one pharmacy and they cannot use the same prescription and fill it in another pharmacy as well. Is that clear? So PDMP, Prescription Drug Monitoring Program, it's a state-by-state program. Is that clear? Okay, next one. Type of error can occur when corporate executives pressure pharmacy staff to meet imposed time constraints, often with consequences if they are not met. Say, for example, you only have 5 minutes to talk to the patient or on the phone. Like there's a limit, okay? There's a time constraint. What is that? Rushed error. Very good. Rushed error. Which of the following statements is true regarding the cost of medication errors? Say true if true and false if not. Okay. Medication errors do not have an economic impact. False, right? Because our taxes sometimes are the ones that are being used to pay for healthcare. Okay. I shouldn't say sometimes, most of the time. Okay. Legally, no one can be held liable for a medication error. False. Medication errors rarely happen, and economically, it is minimal financial loss. False. How many deaths? 7,000 in the United States alone. 20,000 errors back in 2014 was what FDA recorded a year. Okay. Medication errors can cause loss of work, increased hospitalization, and potential disabilities or death. True. Okay. Which of the following patient rights are violated if capsules are dispensed instead of tablets? Actually, it's not really wrong. You can replace tablet with capsule and capsule with tablets. Except if you have the patient has an instruction to cut it in half, because you can't cut a tablet. Are you following? But if we're going to stick to which right, it's the wrong form. Wrong dosage form. Okay. Which of the following would not be not a red flag on a DEA number on a prescription for oxycodone? Okay. Say red flag and not a red flag. Missing DEA number, is that a red flag? No, because you can pull up a doctor's DEA number. It's on record. You can pull it up in your system. It's not really a red flag. Doctors don't write your DEA number. Okay? Incorrect DEA number. Incorrect DEA number. That's a red flag. Okay, you just created a DEA number. Typed out DEA number. Not red. Not, because it can't, the doctor may have a pre-printed prescription. That, okay? Illegible DEA number. It's a red flag. Technically, all of this are red flag except for the typed out DEA number. However, reality, you can look up a doctor's DEA number. Okay? So on the test, which one are you going to choose? Well, all of them are red flags. Except for the typed out. But there's not a lot of doctors who type out their DEA number. we can pull up doctor's DEA number. Okay? Just so you know. Okay, next one. The ISMP has a program for collecting and tracking data called VERP. 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 What is that? I put it under VAERS because they're related. Any? Vaccine Error Reporting Program. And what's VAERS? Vaccine Adverse Event Reporting Program. Reporting system, I mean. Okay, good job. Okay. Next one. Which of the following are ways we can increase safety and promote a safety-oriented workplace? Say yes or no. Use shortcuts, rush through filling. Do not take the time to ask help due to the waiting line. Okay, so this goes to your prescription packet. Why did you not ask me if you didn't know? Right? Look it up, then ask me. Okay, I remember the ones who asked me. Because they didn't know, right? Ask your pharmacist. There's no dose. So what do? Yes, your pharmacist. It can't be used as directed all the time, right? It has to be an instruction for the patient. Most of the time, you already have an instruction. The patient still doesn't follow. Okay. Do not take the time to ask for help due to the waiting line. Always take the time to ask for help. You're never a bother. Okay. Triple check our work. Ask for help. Watch for alert fatigue. Yes. Ignore med guides, safety alerts, and figure pharmacists will catch all your errors. You are partners. Okay. Next one. Which of the following drugs is not considered high risk and would not require a risk evaluation and mitigation strategy or REMS? Isotretinoin, high risk? Yes, that's your retinol. Very good. Transmucosal fentanyl. Yes. Subutex. I want you to look up what Subutex is before you say no.
Yeah.
What is Subutex? Okay. Motrin. That's your exact. Your Motrin. Okay. This is a terminology. What type of dependence occurs when a patient takes a drug on a regular basis because it produces a sense of well-being that the patient does not want to consider being without? Physical dependence, psychological dependence, addiction, or tolerance. I'll read it again. A type of dependence that occurs when a patient takes a drug on a regular basis because it produces a sense of well-being that the patient does not want to consider being without. Psychological dependence. Very good. Sometimes you have to read it. That proves to you that you have to read the problem again, right? Or the question again. Drug-seeking behavior includes all of the following except say yes if it's a drug-seeking behavior, say no if it's not a drug-seeking behavior, okay? A patient insisting on paying cash only for their narcotic.
Drug-seeking. Yeah.
Red flag, cash. Why can you not afford a health insurance when you can afford to pay Oxy's cash, right? No DEA number on a prescription for morphine.
No, because you said you could put it up.
Right, but this is a test. Prescription has been altered with a different color ink. A patient who appears in pain. In reality, they can act like they're in pain, right? But that's the answer. Okay? But so many of our drug addicts or dependents are so good at pulling the drama. Okay? But you can tell by other actions. Okay, with their other actions. We're almost done. Guides are medication information sheets and are considered which part of the patient's 7 rights? Very good. What is it called when the body adapts to a drug so that higher doses are needed to produce the same pharmacological effect? Very good. Remember I told you when a drug addict has to go through surgery, Okay.
Only gonna be-
They gotta, I mean, the anesthesia doesn't work. Especially if they shoot them. Yeah. So you keep upping it, but it's not good because you might not wake up. You know? According to the DEA, about how many Americans abuse pain and anxiety medications? Guess.
70%.
In millions.
Oh,
Can you guess?
no, like 9 million.
Close. Getting warm.
10 million.
Lower.
8 million.
Lower.
7.
7.
7.
Around more than 7 million, actually. More than 7 million people, according to the DEA, abuse pain and anxiety medications here in the United States. I would believe that it might be more than that. Okay. PDMP, I talked about it, is a program designed to gather data on controlled substance drug use with a majority of states participating. What does PDMP stand for?
Prescription.
Prescription Drug Monitoring Program. Good job. Which of the following is not a cost impact of medication error? Lost time at work. Cost impact, not a cost impact. Lost time at work. That's a cost impact. You're not going to be paid if you don't go to work, if you don't have PTO, right? And if you're contractual, you don't have PTO. Lost productivity. Additional hospitalization. Increased trust in pharmacy. What type of error occurs when a pharmacy employee is interrupted in the middle of a process of... Very good. Which of the following regulatory bodies issues the list of error-prone abbreviations? So if TJC issued or released the do not use list, who do you think released? Very good. The error-prone abbreviations was released or issued by the ISMP. Good job. What's ISMP again? Institute for Safe Medication Practices. Okay. Remember sequence 3 if you were with me. Okay. Dosing. Oh, this is sequence 4 too. I repeated it in sequence 4, which is this sequence, right? Okay. We have, sometimes there's a very thin line that separates the therapeutic dose from the lethal dose. Okay. Okay. Patient that are taking these types of medications must be monitored since there is a very small difference between the therapeutic dose and the toxic dose. Do you call this broad range drugs? Do you call this high risk drugs? Do you call this narrow therapeutic index drugs? Narrow therapeutic index drugs. So they have to be carefully monitored. Okay. The MERP, what's MERP? We have the verb and then we have the verb. Remember, we have the med watch and we have the med marks. What do you think is MERP? If this is vaccine, error reporting program, this is medication, error reporting program. All right. The MERP is provided by which regulatory body? Which do you think? Very good. That's why I attached it here. Yeah. So all of those abbreviations, like there's a reason why I put this under here and here. Okay. ISMP, very good. Okay. When selecting medication off the shelf, what number should we verify so we are sure we are selecting the exact medication order? NDC number. Here's another question. What number do we use for recall? Lot number. Good job. Any questions? That's patient safety. We go on a 5-minute break and let's start computer applications. Okay? So come back at 11:21. 11:21. Restroom break, breathe break, stretch break. 5 minutes. We'll be back in 5 minutes.
¿Esto qué está aquí? Lo veo.